Hand washing is key. Soap and water for at least 20 seconds. Frequent hand washing, especially in nurseries, especially in schools. The virus tends to attack mainly in the northern hemisphere in the months between September and March.
And
So we try to kind of
all these tests.
I retired, and obviously, but thankfully.
All right, welcome back to Tell Me Why. Today we're going to be discussing respiratory illness. And we've discussed a lot of these, especially when it comes to like the back to school season or children in general, children that bring back these illnesses back home to the rest of the family. So today we're actually going to talk about respiratory syncytial virus, which is RSV for short, with Dr. Feroza Dawood, who's an obstetrics and gynecology. How are you?
I'm very good, thank you, Maria. Good to be here with you today.
It's lovely having you as well. We love talking about these topics because A, we raise awareness, and B, we help, parents that might be struggling with these diseases, how to, like, we just inform them on how to cope and what are the symptoms to look out for. So we're really happy that you're with us here today, because I think the first question I'm going to start with is, what is RSV?
Okay, so you've already mentioned the full name of this virus. It is respiratory syncytial virus, for short RSV. And it is a virus that primarily affects the upper and the lower respiratory tract. A very contagious virus, which means it can be very rapidly transmitted from child to child, and even from child to parents and even grandparents.
Okay.
Now, as I mentioned, it mainly affects the upper and the lower respiratory tract. So that's the ears, the nose, the throat, and the lungs.
Mm-hmm.
What is concerning about this virus, particularly for children and infants, so infants, from birth up to 12 months of life, is that it is RSV is the leading cause of respiratory infections in infants.
Oh.
So some data reveal that, from the US, reveal that 80,000 admissions to hospitals annually are due to RSV infections of the lower respiratory tract.
Wow. Okay. And how does it spread? I mean, is it just like any other respiratory disease, through contact, through coughing? I mean, I know it's a simple question, but how does it spread?
Yes. No, actually, it's an important question, Maria, because knowing how it spreads can help us understand and help parents know how to prevent the spread as well.
Right.
So as I mentioned, it is very contagious. It can spread very rapidly. When a child is infected or an infant is infected, then typically the symptoms will be runny nose, nasal congestion, so nose keeps running, or they start coughing, or they start sneezing.
Mm-hmm.
But when a child then coughs or sneezes, they are basically releasing these respiratory droplets. And these droplets can remain on hard surfaces for quite a few hours. So if somebody then touches that, they are likely to also get infected.
Right.
Furthermore, of course, when a child sneezes, then the respiratory droplets can be airborne and so very, very easily transmitted.
Mm-hmm, mm-hmm. So you mentioned a lot of common symptoms between RSV and other flu-like diseases. How would you know that it's RSV? Like, how would you deduce through symptoms, or what are some of like the unique symptoms of RSV, so that parents can actually differentiate between RSV and just a flu or just any other respiratory disease?
Sure. I have to say it can be very difficult to distinguish between a common cold, the flu, or even RSV. The symptoms are very, very similar. The only way for us to diagnose whether it is indeed RSV is to do some swabs, usually a nasal swab or a nasal and a throat swab for the younger children. The symptoms, again, are very similar to the common cold or the flu. In children, largely fever, headache, coughing, sneezing, maybe earache as well, fatigue. in the infants, these are the smaller babies, the parent should be alerted when the infant becomes very fussy or irritable, is not sleeping well, does not want to take their feeds, their milk and other, softer foods, and also does not want to play. So they just feel lethargic. So these are some signs to look out for. And certainly most of the symptoms of RSV, like the common cold and the flu, can be quite self-limiting. So if it's mild, the children can recover within 24 to 48 hours. So if a child is worsening and is not, and the fever is getting worse, or the child is then becoming dehydrated, or is showing signs of having difficulty breathing, it means that this could be RSV, because it's getting worse.
Right.
Okay. So we get very concerned about RSV in particularly attacking the airway passages in the lungs. So a sore throat, a runny nose, a cough can be very mild. But once the virus starts attacking the airway passages in the lungs, the smaller airway passages called the bronchi or the bronchioles, then the virus could attack these airway passages, causing inflammation, mucus production. So we get a bronchitis or a bronchiolitis in infants. And then worst scenario is this attacking the cells of and the tissue of the lungs, leading to a pneumonia.
Oh, wow.
So when that happens, then the child will have difficulty breathing, because essentially less oxygen is getting into the lungs.
Right.
So the child may start having symptoms of wheezing, increased breathing, difficulty breathing. So these are alarming symptoms, and for sure parents should then seek medical attention.
Right.
Ideally before the stage. But
Right.
yes, they should monitor the symptoms of the child.
Right. Absolutely. And it's always about, preventing it before it gets worse.
Absolutely.
Basically. So why is it, you mentioned children and infants and, between newborns to 12 months especially. Why is it that they're more prone to RSV? And how is this like a concern for pediatric healthcare?
That's a very good question, Maria. The issue is that whenever an adult, for example, let's just talk about adults get infected, we have an immune response. So when you contract any illness, a virus or bacteria, your body tries to fight it off. Even as adults, we don't fight off some illnesses. And
yeah,
we
I was just going to say.
them, okay,
yes.
we succumb to them. But with newborns, especially up to the first 6 months of life and up to 12 months, their immunity, their ability to fight off a virus or indeed a bacteria is limited and compromised, because the immune system is very immature. It is still developing. So they are more susceptible to not only contracting the virus, but then also having difficulty fighting it off. And then it can rapidly develop into a more serious infection. That is why we get very concerned when infants and younger children under the age of 2 in particular contract the RSV virus, because their immune systems are not like that of an adult, and it's still developing, and they struggle fighting off the virus.
Absolutely. Yeah, that makes sense. We build our immunity as we get older. So if we're talking about infants, they haven't built anything yet.
Yes.
They're still in their foundation years. So we spoke about the fact that it's a highly contagious virus, and we've spoken about the fact that we've spoken about the symptoms of the virus. So how can we prevent it? What are some of the preventative measures that parents and schools can keep in mind, especially schools? Because let's face it, our children spend the majority of their day in schools.
Yes.
And that's how viruses spread. It's not because the school is not doing its job. It's just, this is life, basically.
Absolutely correct. So yes, the transmission, particularly in schools and even in nursery school,
Yes.
can be very rapid. Children can get infected and then reinfected and spread the virus to other children. So prevention is the key. If if a parent knows that their friend of their child is sick, best to avoid children who are sick.
Yes.
Even in school, the advice is for parents, if your child is sick and showing these symptoms of even coughing and sneezing, better to keep them out of school.
Yes.
The same for nursery. it is better not to send them to nursery because then there's a risk that they will infect other children. Now, as I mentioned before, it is extremely contagious, which means when a child or an infant is coughing or sneezing, these droplets are airborne and then going to surfaces. So when the other children touch these surfaces or even toys in nurseries, they can get the virus. So hand washing is key. Soap and water for at least 20 seconds. Frequent hand washing, especially in nurseries, especially in schools. For nurseries, we recommend that the toys, because children are playing with toys in nursery, that the toys should be also washed and ideally disinfected frequently. So even in schools, there's often this peak. The virus tends to attack mainly in the northern hemisphere in the months between September and March. These are the autumn and the winter.
Yes.
When it is a bit colder as well, the virus seems to thrive in these seasons. So we have to be careful. And of course, if a child is also coughing or sneezing and they are of an age that they can understand, they should sneeze in a tissue, throw the tissue in the bin, cough into a tissue ideally or in their arm, so prevent infecting other children as well.
Absolutely,
Yes.
absolutely.
And parents and teachers should also be vigilant.
Yes.
About limiting the transmission from child to child.
Yes, absolutely. Sometimes parents, they don't think it's a big deal, or they think, oh, she just has a runny nose, or he's just coughing in the morning, but it's nothing serious, and they don't mean it to harm other children. They just don't understand the severity of it and how contagious it might be.
Yes.
I love that you mentioned the different seasons, because that was one of the questions that I had in mind. I was actually going to ask, why is it that there are certain outbursts of infections in certain seasons? And you mentioned that in the cold sometimes these viruses thrive, basically. Yes. Why is that? Is there a science behind it?
I mean, there's no scientific evidence behind why these viruses thrive, because they can also infect children in the summer months. But
absolutely,
all the data suggests that the peaks are in these months between September and March, autumn and winter.
Okay.
Perhaps because again, children may be a little bit more immunocompromised because they're not eating better or maybe hydrating themselves adequately.
Yes.
So yes, but no hard scientific evidence as to why that is the case. But certainly we witness peaks in these months.
Absolutely. Yes. Okay, so now let's talk treatment and solutions, basically, that have come up recently for RSV specifically. Is there anything that has shown significant results?
Yes. So again, a very good question, Maria. One of the, I think, a groundbreaking pivotal moments in the fight against RSV is the development of a vaccine that is given to pregnant women. So I've mentioned quite a few times already that the most vulnerable amongst the children on the whole, but in particular the infants from birth up to the 12 months of life. With the peak in the first 2 or 3 months of life, these infants are really exposed to RSV. So the idea behind vaccinating pregnant patients is that the vaccine would allow the pregnant patients between usually 28 weeks up to 36 weeks of pregnancy. The mother will then develop antibodies. The antibodies will then pass through the placenta into the fetus. And then the baby's already got some protection in the form of antibodies from birth. And that protection lasts all the way up to at least 6 months, perhaps beyond, but the studies for sure up to 6 months. And this protects the infants then who are vulnerable from getting these very serious lower respiratory tract infections in particular.
Okay. I didn't know that there was a vaccine for pregnant women.
Yes. I mean, it has been launched only in, there's been lots of studies to produce such a vaccine over the last few years. Certainly in the UK NHS system, from the 1st of September 2024, it has been rolled out routine RSV vaccination of pregnant patients. It's already underway in America as well as Europe. And in the UAE, the Department of Health has put it in the antenatal standard of care, RSV vaccination of pregnant patients.
Okay, I was not aware of that.
Yes. So this is an important, as I said, a pivotal moment in the fight against RSV. And it's amazing that we can do this to protect infants and children. Because again, if your infant is protected, hopefully if you have older children, they will also then not contract the virus from your infant.
Absolutely.
So this is a really landmark in the fight against RSV.
Absolutely, yeah. That ripple effect of infecting everyone in the household really is taxing. It's exhausting. It takes a toll on the family, and it's like a never-ending vicious cycle.
Absolutely.
One person gets sick, the other gets infected, and it's
Yes.
It is quite concerning. And there is another point that I actually wanted to address is going into hospitals and seeing, these severe cases can be alarming if you're not a medical professional, seeing, children getting hospitalized. How severe does the case have to be for a child to be hospitalized, and how are they taken care of under this hospitalization?
Yes. So we try to keep children out of hospital as far as possible, because again, we don't want to be, they get separated from their families, although parents are usually with the children in hospital. But the children who are showing signs of hypoxia or who have developed pneumonia, who are having difficulty breathing, they have to be hospitalized because some of them will require oxygen.
Right.
Because a lack of oxygen then causes difficulty in breathing. So some of the children will require oxygen through a nasal cannula, so a little passage through the nose, or just a face mask to give them the oxygen because they're struggling with their breathing.
Right.
Or they might be wheezing. So we will also be treating the wheezing sometimes with humidifiers or just trying to keep the child hydrated, because often what happens is they succumb to the virus. Their whole body gets tired to try to fight off the virus, and then they don't drink enough fluids, and then they get dehydrated. So another mainstay in the treatment is to put them on intravenous fluids. This is fluids through a drip.
Yes.
So again, we only hospitalize the most serious cases, mainly lower respiratory tract infections. So that is the bronchiolitis, the bronchopneumonia, bronchitis, and pneumonia as well.
Okay, so what we've been talking about in general right now is how RSV affects children in general. But then I want to get a little bit more specific. How does it affect children with pre-existing conditions, or children with, chronic illnesses or previous illnesses? Let's say just a child with a pre-existing condition. How is it more severe? Does it affect them differently than?
Yes. So you spoke about chronic illnesses. For example, if a child's already asthmatic, for example, that is a chronic illness.
Right.
They're already immunocompromised. So if they're exposed to the RSV, again, they don't have the ability to fight it off as effectively as a child who does not have a chronic illness. Other areas where children are a little bit more susceptible is if they are premature, so premature infants.
Yes.
So infants, even term infants, have a weak immune system, as I discussed earlier.
Yes.
So you can imagine a preterm infant, a premature infant, is even more compromised. And so their immunity is very, very weak. So they are at higher risk of contracting a severe form of the RSV. So
Right.
it becomes, it rapidly worsens in a premature infant. Or some children with congenital heart defects as well. They have a less ability to fight off the virus. So that can be quite challenging, and again, hospitalization for these children can be sometimes inevitable.
Yeah.
There is a campaign in the UAE as well to try to protect these more vulnerable group of children by giving them some monoclonal antibodies. So there is also there's a kind of a protocol where if children are fit into this category, then they are eligible to get something called a monoclonal antibody to help them fight the RSV.
And this is after they get diagnosed or
Yes.
before?
Yeah.
Okay.
Before and after.
Okay.
Yes. Again, we want to prevent it, but it's before or after.
Okay.
Yes.
And as a person in the healthcare, industry, and as a physician, obviously, and especially because you are in obstetrics and gynecology, so you do deal with pregnant mothers and existing mothers and, people with children.
Yes.
What do you think hospitals are doing to raise awareness? Do you think they're doing enough? And do you feel like there's more that we can do? Do we have a responsibility towards these vulnerable, let's say, groups,
Yes.
people that are more prone to getting RSV? What do you think hospitals should do, and what are they doing to raise awareness?
So again, as an obstetrician, I'm very excited that we now have the RSV vaccine because prevention is better than cure.
Right.
So I think we need to do to have more campaigns to make the public aware, especially pregnant patients now, that there is a vaccine available, because we want to prevent infants from getting the RSV.
Right.
So to start off, I think we need to increase awareness of the vaccination program.
Okay.
Especially for RSV. So this is for the pregnant patients. And then, again, awareness in schools, in nurseries, and in the public as a whole, that, if children are infected, what are the symptoms and signs to look out for, encourage hand washing,
Right.
encouraging, safe practices like throwing your used tissues in the bin, and safe containing sneezing and coughing, etc.
Yes, yes.
So I think we do need to embark on better educational campaigns and educate teachers and nursery school caregivers as well. But hospitals as well have a huge role in increasing awareness, public awareness about RSV.
Yes. I love that you mentioned practices and awareness on preventative measures, because we all thought it started with COVID, but actually it started long before that.
Indeed.
I grew up in a family filled with physicians, and washing your hands for 20 seconds and sneezing into your forearm rather than your hand was always the case. But people only started realizing it when COVID hit. And it's just funny that, you mention it now.
Yes.
But it's a given. It should be a common practice.
Yes, absolutely. I mean, RSV has been around way before
Exactly.
we were aware about COVID.
Yes.
And I think there is definitely this better awareness post-COVID, because during COVID we were all taking these precautions.
Right.
But I want to encourage parents to continue
Yes.
with these precautions, because RSV can be extremely serious.
Yes.
And we want to prevent it getting to the point that it is so serious that the infant or the child needs to be hospitalized.
Yes.
So all the safe practices that we all did as the lay members of the public during COVID,
Yeah.
we should continue doing that.
Yes.
And make it part and parcel of life, really.
Yes.
These are good, good habits to inculcate, and we should continue doing so.
Absolutely. The key that you mentioned is preventative, not reactive, or not cure.
Sure.
We should look at how to prevent rather than reaching a point where now we have to problem solve, and it might be severe and taxing on a family.
Absolutely.
Dr. Feroza, thank you so much for your time. This was very insightful. Thank you for sharing your knowledge and for raising awareness. I think you were mentioning that we should have awareness campaigns. This is, a starting point, spreading the word and getting your voice out there so that parents are more aware about RSV and how to prevent it. So thank you so much for your sharing.
You're very welcome indeed. Thank you, Maria.